And I think, unfortunately, a good place to look towards what might happen is what we are, last week and this week is the Commission on the Status of Women in New York. The US is extraordinarily aggressively anti-gender in that space and working very closely with key anti-rights groups, civil society, and also other UN member states. And they are going extremely hard after the word gender and even gender equality and gender equity. So we know that this isn't that on one hand, yes, this is an absolute witch hunt for LGBTQ folks. That certainly that's the point of these policies in terms of their application to foreign assistance. And we can see how that's playing out language wise in other spaces like the UN.
The United States has just launched a new policy for its foreign assistance, seeking to condition $40 billion of non-military foreign assistance. It is described as human flourishing in foreign assistance. Let's talk to Jamie Vernaelde of Ipas, who will explain to us what it's actually all about in terms of preventing foreign organizations, foreign governments, and multilateral agencies from working on issues of abortion, gender equality, diversity, equity, and inclusion. Hello. Welcome to the famous podcast. I'm François Girard, and today I'm very pleased to welcome Jamie Vernaelde from IPAS, the international organization that promotes sexual and reproductive health and rights, and particularly abortion rights. Jamie is a senior researcher at IPAS, where she tracks and reports on global anti-rights movements and on threats to sexual and reproductive health and rights and to gender justice. She has over 15 years experience in research, policy analysis, and advocacy, and she's led investigations in Africa, Latin America, and the Caribbean on the impacts of U.S. foreign assistance and on crackdowns in civil society and human rights violations. Her focus is on women's, children's, and LGBTQI plus rights. So Jamie's expertise is actually, especially her expertise on U.S. foreign assistance, will be very useful today. As today we seek to understand one of the latest foreign policy and foreign assistance outrages, and there's so many, of the Trump administration. This policy, which is the so-called promoting human flourishing in foreign assistance policy. This policy was announced by VP J.D. Vance, Vice President J.D. Vance, in January of this year at the Anti-Abortion March for Life in Washington, D.C., and it came into effect on February 26th, so it's a very fresh development. And as you can guess, this policy does, in fact, nothing to promote human flourishing. So let's try to understand what it will do or seek to do. So welcome, Jamie. Welcome to the famous podcast.
Thank you so much, Françoise. And I'm very sad to be here to talk about yet again what you mentioned, a latest foreign policy outrage from this administration, among many.
Yeah, it's not the only one. Some of us, who've been tracking Republican policy, foreign assistance policy over the decades, have taken to calling this latest version the Global Gag Rule 3.0. Because in a way, it does expand on similar policies going all the way back to Ronald Reagan. But I'm curious if you think this is the right framing, because this, in fact, goes much broader than just global gag rule on abortion. Let's dive into the history of these policies, these conditionalities attached to U.S. foreign assistance to understand what we're facing now and what terrible further damage it could cause. So, to start with, if you had to describe this new human flourishing global gag rule 3.0 in a nutshell, what would you say?
Well, I think we do like naming things.
Yeah.
And I think the 3.0 makes sense on one hand because there are three new rules, and we can get into each of them, but I think as a
Yeah.
framework, they're rooted in the first anti-abortion rule, OG, global gag rule that, as you mentioned, is as old as I am. It's 40 years old. Actually, no, it's a little bit older than I am. But that was
1984.
at the core of what we see with these three rules, is a
Mm.
very anti-abortion thrust from the Republicans under, as you mentioned, President Ronald Reagan. But like you say, it has since massively expanded, one would say exponentially, under different Republican administrations. And it's been rescinded by Democrats in between. But every time it's been put in place again, new expansions have happened.
Mhm.
What we have seen under the current US administration and under the first Trump administration is just absolutely not even tripling, I would say mushrooming of the policy, and then ideological expansion beyond abortion to what we can get to of what does human flourishing actually means, but
Right.
that ideological agenda that is far beyond being the anti-abortion core.
Mhm. And let's talk about how it has, the conditions attached to U.S. foreign policy, the sort of a Christian, Christian far right conditionalities attached to U.S. foreign policy, because this is really where it originated. This anti-abortion drive from the 1980s attached to U.S. foreign policy. Now, we're looking at something much broader. Can you talk about how it specifically it evolved over time, like both in terms of the money that was
Yeah.
conditioned, and then which entities were targeted with this, and now in this latest version, what topics are now envisioned as relevant to this conditionality?
Absolutely. And in the first the Reagan years and then the Bush senior years, we're talking mid to late 80s, early 90s. It was again really about abortion, and it was targeting planning funding coming out of the US Agency for International Development, another topic we can talk
Yeah,
about because that no longer
USAID,
exists.
right.
But that was about 300 to $500 million a year of funding.
Hmm.
You go to next to Bush Jr., the 2000s, it goes beyond USAID to State Department, but still just family planning. So
Hmm.
again, a relatively contained $500 million or so. And then we get to Trump 1.0. And at first, it was the same things, but applying to all global health funding. And that's where you see where we go beyond just abortion, just family planning, to now implicating really integrated health programs. And we can talk about what that means. But that's where you get that first expansion under Trump to $7 to $8 billion worth of global health funding.
Hmm.
And now, with this latest expansion, that even, when you mentioned JD Vance, when he did his speech in late January to the March for Life,
Yeah.
he talked about tripling protecting the unborn. And that's where we see not only of expansion to that global health funding, but beyond to all entities receiving US non-military US foreign assistance. So originally the policy only, for the most part, affected foreign non-governmental organizations. Now it's any entity receiving US funds. So huge number. And we can delve into that if you'd like.
Yeah.
But also, again, beyond abortion to looking at what you can do with money around diversity, equity, inclusion, around gender identity, and around the word gender at all. So, a massive change in the types of organizations that are affected, the kind of funding, and the kind of prohibited quote unquote activities
Hmm.
that this administration is going after.
So over the decades, we go from 500 million a year of U.S. foreign assistance to 7 billion to now 40 billion, more or less.
Yep,
All,
thereabouts. Yep.
all U.S. non-military foreign assistance. That's a lot of money, 40 billion a year. And then it goes from, as you say, abortion, basically try to prevent groups receiving it from speaking about abortion, to then moving into more, you know, by virtue of which groups were targeted, conditioning entire health systems not to do anything about abortion, not just the family planning groups. And now we're talking about diversity, equity, and inclusion, gender equality, and of course, still abortion uh, is going to be verboten. So that's that's a very ambitious frame, from the U.S. to try to seek to bend or not just organizations, but UN agencies are now in the mix and foreign governments to try to bend them to their will.
And I think on that note, it's bending it to this will, and arguably, I think Americans, the State Department, whoever would say, we have the right to do what we want with the funding we provide. But what is fundamentally so nefarious about this policy is that it's if I give you X million dollars to do a program, sure, I can say that you can't do certain things with it. But you as an organization have agency and should be able to use other funds
Hmm.
from any other government, from personal reserves to do other programming.
Right.
And what this policy does is it poisons that well of funding that you have from other entities, saying you can no longer do any of this work. And the partners that you might work with who receive funding from you can't do this work either, even if they don't receive US funding, but they do through you. And that's where it's just has massive implications, even though we've seen the reduction of US foreign assistance because of the closure of USAID.
Wow. So and that was always true of the global gag rule in its early iterations. They sought to tell foreign and organizations, non-governmental organizations, if you take U.S. funding, even if you have funding, let's say from the Dutch
Yeah,
government to work on abortion, if you accept our funding, you can't work on abortion, even with your own funds or funds from another donor. So that was
correct.
what you say when you say poison the well. It was this very difficult choice, which is comply with our vision, our Christian far right vision on abortion, or forgo our money, which could be in some cases a lot of money. U.S. government
Yeah.
funding used to be very significant. So you stay true to your mission or shut your doors, kind of thing. Yeah, very difficult choices for a lot of organizations on the ground in remote places where there's not a lot of other funders. Like in Western Kenya, where I've been many times, it's a very difficult choice. To provide those services or not, take US money and maybe use it for some, yeah. So, you have to make this devil's bargain with the US. And now what you're saying is they're trying to do this with the 40 billion on a much bigger scale with a range of topics, not just abortion.
Yes, exactly.
So if you're working on gender, diversity, equity, and inclusion, whatever, and you take US funding, you can no longer work on diversity, equity, and inclusion. Is that it? That's
Well, this is where also we don't quite know how any of this is going to be enforced, right?
right.
Because
It's so new.
you have the first rule that says the original, I said the OG gag rule was around abortion, and it's been renamed several times by the administration. We refer to it also as the Mexico City policy. It's been
Yeah.
called most recently protecting life and global health assistance. So
Correct.
that's the first of the three rules now. But then, as you mentioned, you also have the combating gender identity in foreign assistance.
Hmm.
And then the third one is combating what we would call diversity, equity, and inclusion, but what they've renamed to is discriminatory equity programming. And a bit of what is, to a certain extent, that's gobbledygook.
Yeah.
And I think the main thing to remember is they are rooting this in more recent US administration ideology that came out of the end of the first Trump administration, which
Hmm.
was the Geneva Consensus Declaration, which is distinctly anti abortion and anti LGBTQI. The people who were involved in framing that Geneva Consensus Declaration were involved in Project 2025.
Yeah.
So that's where we're seeing a lot more of the recent extremist language coming in from this administration and its
Hmm.
civil society allies.
Hmm. Hmm. And the people who came up with the attacks on so-called critical race theory
Exactly.
in Florida, where you couldn't talk about gender and you couldn't talk about race anymore in the classroom. Yeah, it's all. As I read some of these executive orders, the latest one, this Human Flourishing, like, wow, I recognize this language.
Mhm.
It's exactly what Florida under Governor DeSantis adopted to basically curtail discussion of gender and race in the classroom. It's the same playbook. Yeah,
And so that's what's confusing is what does it mean to go after DEI and foreign assistance? Is it going to be anything that mentions LGBTQ? Is gender specifically going to be targeted as a word?
yeah.
If you read through Project 2025, you kind of get the impression that they, control found, control F'd for
Hmm.
certain topics.
Hmm.
Is that the way it's going to be with applicants to new funding? If there's new funding from the US administration, that if they see the word diversity, um, that's what they're going to go after. It's just going to be, frankly, some AI bot a la early days of Doge
Yeah,
with
well, we saw
Musk's
these.
kids coming
Yeah,
after
yeah.
certain
Just,
keywords.
Chat
Um,
GPT, tell me, if you see the word gender
exactly.
or women. Yeah,
And I think, unfortunately, a good place to look towards what might happen is what we are, last week and this week is the Commission on the Status of Women in New
hmm,
York. The US is extraordinarily aggressively anti-gender in that space and working very closely with key anti-rights groups, civil society, and also other UN member states. And they are going extremely hard after the word gender and even gender equality and gender equity.
yeah,
So we know that this isn't that on one hand, yes, this is an absolute witch hunt for LGBTQ folks.
yeah, yeah.
That's the point of these policies in terms of their application to foreign assistance. And we can see how that's playing out language wise in other spaces like the UN.
Yeah, so it's much broader potentially when you're going
Yes.
at the Commission on the Status of Women after gender equality.
Yeah.
This is it, right? They're really
Yep.
going for anything that might advantage women or that might redress discrimination against women and girls. I mean,
Yep.
potentially, right? So, I mean, let's wind back a little bit to talk about the damage. Like several groups at the time documented the damaging impact of the OG global gag rule, 1.0, 2.0, which really focused on healthcare funding and health systems. Um, and it prevented groups that accepted U.S. foreign assistance from advocating on abortion and providing referrals and all that. They were already forbidden from providing abortions with U.S. foreign assistance because of the Helms Amendment, which was a separate restriction. But that's why it was called a gag rule, so that if you took U.S. money, you couldn't even speak about abortion, even in a country where abortion had been legalized or decriminalized. So but groups really documented, and IPAS did that as well as others, the damage that this policy caused to health systems more broadly. Can you speak a bit about that so we understand how far this can go?
Yeah. And I think a good example of that and how not even counterintuitive, because that's just such a simplistic way of saying it. But if we remember, things like the President's Emergency Plan for HIV/AIDS, PEPFAR, was
Hmm.
created under George Bush
Bush,
Jr.,
yeah, George W.
George W. Bush, good old W. And that was at the time, senators who are now so far extremely right, like Chris Smith, were champions of PEPFAR.
Yeah,
And the whole point of PEPFAR and other USAID programming that came out of that was integrated health systems. There was
right,
such a big push around that in the 2000s and the 2010s. And the whole idea there was I, as a pregnant mother, could go to a point with my child and get a slew of services,
hmm,
including, gender-based violence programming, nutrition for my child, the jabs and vaccines that we both needed. Like that was the idea of one point of contact,
right.
and you could get HIV screening and all the rest.
Cancer screening,
Um,
yeah. What? Hmm.
Integrated health services.
Hmm.
It makes sense, especially as you were talking about the example from Kenya, remote areas where it's hard to get to a health system, it's hard to, the amount of walking and all the rest, you want one point of contact. And that was the best way of reaching the hardest to reach people. If you go after the one organization that is providing those services because they want to also be able to refer young women, young people for all other services, including safe abortion care, the amount of people you're losing as a result of that closure of that clinic, or the inability of some service providers use vehicles to reach people and to do mobile clinics.
Right.
You are cutting off whole communities, not just that individual person with child. And I think that that's what we don't talk about enough, the damage of these types of ideological policies. And that's the thing is, they're not about human flourishing, as you mentioned at the beginning. They're not about, they reference, like I said, the Geneva Consensus Declaration, which talks about protecting women and girls. That's not the point.
Mhm. I mean, I remember talking to Monica Ugutu in Kisumu in Western Kenya, and she's a nurse midwife who runs an organization called KMET. And she said, sometimes they say to us, but why? There could be two organizations: one that provides abortion with funding from other donors, and one that does everything else. That was the thinking of the people who were trying to figure out a solution. And she goes, we don't have additional nurses in this region. We don't have other doctors that can work here. We don't even have one doctor. So we don't have the luxury of multiple clinics, and also, as you say, people don't have the means to walk from place to place, whatever these women, these men, are working hard. They don't necessarily have means of transportation. They often don't have much money. So if you're asking them to do all this to access healthcare because of some U.S. foreign policy idea cooked up in Washington, D.C., what are we talking about? This is totally counterproductive. It's destructive. But there was also a sense that even the groups that accepted this then start to over implement the global gag rule. Like, okay, so they agreed to take the money and not speak about abortion. But then it becomes, someone comes with a miscarriage, or someone comes with, vaginal bleeding, whatever. What is going on? How do you react? Would you be, if you send them to another provider, could you be perceived to be condoning maybe an abortion? You don't even know if if it's self-induced or it's just a miscarriage, but it became a real ethical dilemma for a lot of these clinics, because they didn't want to have the inspectors, USAID inspectors, come in to say, why did you do these referrals to this other provider we heard? Da, da, da. So it started to damage the provision of healthcare, of maternal healthcare more broadly. I mean, did you see that in some of the
Yeah,
research?
and I think to come back to a point you made is for a lot of NGOs, not even small foreign ones, it's an impossible decision, or at least it was when the US was really the USAID was the funder for this type of
Yeah,
work.
yeah,
So if again, I did some documentation in Uganda under the first Trump administration. If 60% of your funding is from the State Department, USAID, you're never going to say no.
yeah,
But to your point, where does compliance meet self-censorship and over compliance? And I
yeah.
think that's where we also need to talk about the fear of these policies, the auditing that you're talking about.
Hmm.
Um, Even before right now, these three new rules are technically in effect on they, as you announced, February 26th. However, they need to be applied through funding. So right now, some of our organizations are already afraid to do certain work, even though this new policy has not been written into new tranches of funding,
Yeah,
new contracts.
yeah,
It's that fear of, is the US already going to start asking questions about abortion, about LGBTQ, about, DEI of whatever that means. And so we're already gonna not just stop talking about certain things, we're going to scrub websites.
Mhm.
We're not going to go to certain partner meetings
Mhm.
because even though I might not be able, if I receive US funds, I might not be able to do, so say certain things and do certain things. This policy affects really speech and activities. But then I'm gonna go, I shouldn't be in that meeting with partners who still do things, even
Yeah.
though we might be talking about maternal health broadly, about the different pieces that are being picked up. Coalitions are so critical to this work as well in different
Mhm.
countries.
Mhm.
Um, we're gonna start self-censoring in that way, even though the policy is not yet on paper in contracts.
Right, right, right.
And that's where we just talk about outsized impacts over compliance and self-censorship.
Right, the chilling effect. Like, yeah,
Absolutely.
I mean, in the first two iterations, we heard like people didn't want to be in a meeting organized by Mary Stopes International because they work on abortion, or they didn't want to go to a meeting by with Planned Parenthood affiliates, for the same reasons because they had decided not to abide by the global gag rule and forego the money. I mean, those were big organizations that could afford to do so, but many of the local groups, as you say, just couldn't.
Yeah.
And so but then they started to be concerned if they were seen to be in a meeting or on the participant list, or it just became collaboration broke down. Also, as you say, often in places where you don't have a lot of resources, referrals and sharing resources or information is, or going to the ministry together to lobby on something, it no longer happens. It does reduce the effectiveness and breaks apart these coalitions that really seek to advance sexual and reproductive health and maternal health and general health, more broadly. It's
Yeah, and I
it's
mean,
terrifying.
IPAS, like MSI, like IPPF, they used to, some of their members used to receive US funding. IPAS has never received US funding.
No.
However, we've been in this game for 50 years, and because we work in country, we see the effects on the wider, as you say, the wider health systems ecosystem,
Hmm.
the wider health ecosystem. And it's just that ability to continue. I mean, your example of going to the ministry together, whether it's to push, new new policy on teenage pregnancy
Yeah.
and being allowing girls to stay in school.
Yeah.
That's the type of programming that even gets, or policy work that gets affected by these types of policies because, like you say, X organization doesn't want to be seen in the room with a group like IPAS or MSI or whomever
Right.
because of the, like you said, the optics of it, frankly.
Hmm.
And while maybe under the previous versions of this policy, arguably organizations could have pushed back on an audit. Well, yes, of course we went to that meeting because it was on X topic. Given this administration and frankly the hostility, um, and frankly the disregard for civil society writ large,
Yeah.
I think that people are going to be that much more risk averse in these settings.
Hmm. Now, let's talk about multilateral organizations in this context, because this newest version of this policy seeks to condition the work of UN agencies and other multilaterals like the Global Fund to fight AIDS, TB, and malaria, which they never tried to do that before. Like they left the UN alone with their previous versions. Um, what could be? I mean, on the other hand, the U.S. is not paying its dues to the UN, and it pulled out of the World Health Organization, and I think it zeroed out the funding for UNFPA, the Population Fund, and also to UN Women, right? So, but what else could they be trying to do when they speak about
Sure.
multilateral? Have you
Yeah, and I
got
mean,
some thoughts on that?
I think even beyond that, the withdrawal from 66 other international
Yeah.
organizations also happened in the last few months. So arguably, yeah, people would ask, well, what's left to fund? And I think a good example is things like UNICEF, the UN
Mm.
Children's Investment Fund.
Hmm.
And again, if we're thinking through, all right, if we set aside that first policy around abortion and we look at things like the combating gender ideology second pillar. And if in there we're thinking about comprehensive sexuality education, which UNICEF has done a wonderful job of working in countries with ministries of health and education and parents groups and all the rest to create curriculum that's age appropriate and all the rest.
Yes.
If you mention identity in some way or gender, that's not defined under these, as you said, Christian national binaries,
Hmm.
um, is that gonna be something that someone controls fines for and goes after? And that's gonna have these compounding impacts on education and for UNICEF partners, right? Because again, if now that UNICEF and other, multilateral agencies are being treated essentially as foreign NGOs, which the global gag rule always restricted most or targeted first and then is at most risk with these 3 policies, 3 rules, then those types of activities are going to have to be again the policy is going to have to be flowed down to any partners of UN agencies as well.
Yes, yes.
um, and fundamentally having these rules attached to multilateral organization is a complete violation of the ethos of multilateralism,
That's
that you are
right.
all contributing as individual countries to a pot in order to do programming. It's completely antithetical to how these organizations were set up.
Right. And I mean, UNICEF is a big agency. What's their budget? Like 2 billion a year or some such thing. And they receive money from many other governments and other entities. And so what are we saying? All these other governments have to bend to this US vision of discrimination on the basis of identity, whatever, to that's untenable. That's really
Yeah,
unbelievable. And I was reading the executive order on DEI, and by identity they mean race, color, religion, sex, or national origin. So it's not just girls that and LGBT kids that they'll be looking for, but potentially any work that seeks to help kids from ethnic minorities that are being discriminated against, or a religious minority, or racial minority. I mean, this is really
yeah,
nefarious, really, really nefarious. And I can also imagine in refugee situations or humanitarian crisis, this would become very, very dangerous to prevent any
exactly. And
kind of action on issues of discrimination and violence against certain minorities.
yeah, I mean, I'm starting to smile, and I think it's because it's that or crime. But
Mm,
when you think about these things, and humanitarian funding used to be exempt, and now it's being targeted alongside as this has been expanded to all types of funding.
yeah.
And when you think of, like you mentioned, if you have a prevention of gender-based violence program in a refugee camp that is seeking to target a certain group that has traditionally been marginalized,
Yeah.
all of those are flag words now for these 3 executive orders, right? If you're targeting a specific group that is at risk, would that fall under the discriminatory rule? If you're targeting if gender is part of that, are you it's the second one. And if
Hmm.
you are providing services that would include SRHR, sexual and reproductive health and rights, and that would include abortion, even if you, as you mentioned earlier, it was to provide post-abortion
Abortion
care, which is
care.
allowed under these policies. There
Yeah.
are still exceptions for these policies.
Hmm.
Protecting life and global health assistance, the OG gag rule. I'm really sorry if that takes off as a as a name for it. Um, but if you're providing, again, that specific support for a young person who is coming in suffering from an unwanted pregnancy as a result of rape or incest,
Yeah.
and all of those things are now buzzwords for these 3 rules to not be able to provide that type of programming. And yet you put under your heading of these policies, protecting women and girls. It's absolutely ludicrous.
Yeah. I just don't see how this can be done. I'm wondering, do you think it can be done? Like, how will the UN, for example, deal with this? Like, will they just walk away from U.S. foreign assistance? And since USAID has been dismantled, how will is this going to be done through the State Department? How do you see it working in practice?
I mean, that's the billion-dollar question. I don't know, the
Yeah,
trillion-dollar question at this point.
yeah.
A big unknown is, to your point, what type of money are we actually talking about right now?
Yeah.
Um, what type of, not even how much money, but what kind of programs are we talking about? Not only has USAID been decimated, the State Department itself has been gutted and restructured,
Yeah.
and certain specific portfolios are gone.
Right.
So, who is there going to be there to implement this, to oversee it? Who knows?
Yeah.
And what types of contracts are going to be asked for? Who knows? Fundamentally, and I think I'm not the only one who believes this is about cutting out civil society, including the UN. What we've seen in the last
Wow.
few months with the US America First global health strategy,
Mm-hmm.
even the latest national security strategy, this is about the US providing government to government, so the US with X country,
Mm-hmm.
specific funds that have other types of strings attached. And often go hand in hand with um, US business interests around mineral rights and the rest.
Right.
So, this is about dealing directly with governments and making civil society moot.
Mm-hmm.
Um,
Mm-hmm. Mm-hmm.
and we're seeing that in how it's treated civil
Wow.
society in other countries, the UN, US civil society. I mean, we could explode this into talking about media and journalism.
Right.
This is about US foreign interests in a very monetized sense and not caring about global health or women's rights in any way.
That's right. So very naked. And that's why they've signed these MOUs with the various countries in Africa in particular, but also Latin America that require them to uh, give some of their data, their health data to US companies and also sell their minerals, as you say, and implement this policy. I mean, I know that there's in these MOUs a reference specifically to human flourishing being a
And well, there's
condition.
a
Yeah.
reference specifically to the Helms Amendment, which you
Ah, the Helms
alluded to at the
Amendment.
beginning.
Hmm.
And then there's also a little caveat saying, and other US policies. So it remains to be seen. Right now,
Uh,
these MOUs that will theoretically, if money is dispersed, be government to government
hmm.
contracts. Those could have other conditions, but as far as we understand right now, that would be the biggest, the most lax in terms of ring-fenced funding, or rather that those would be the most ring-fenced funds, meaning that yes, they might have to comply with other policies, but as we talked about, it wouldn't poison the well of other government fundings
Uh-huh.
to what we understand so far.
With
So
governments.
theoretically, those MOUs would be the least impacted by um, promoting human flourishing and the three rules.
Hmm. Hmm.
But again, who knows yet?
Yeah.
Because those contracts are supposed to start rolling out. Those MOUs become contracts at the end of April for implementation. Some countries are refusing to sign because of what you mentioned, the data protection issues.
Hmm.
Zimbabwe has refused. Kenya is tied up in legal battles,
Hmm.
also. So we're seeing some countries push
Pushing
back, but
back.
again, a lot of them are in positions where US aid was completely pulled out from the rug, and you have health systems that have also been completely wiped out because of
Devastated.
this.
Hmm.
So you
Hmm.
have to take it.
Yeah, yeah. Now, in closing, I'm wondering what you think of this, because it seems to me that the only, you say this is to walk away from civil society, but I'm wondering if there's not a push also to basically funnel some money to religious conservative groups who are likely to agree with this vision and who are likely not to want to implement anything to do with sexual and reproductive health and rights or gender equality, or rather would implement a very specific view of gender as traditional gender norms. So I'm wondering if you think some of that may be a way to redirect money to these religious groups.
In short, yup.
Yeah.
And
Yeah.
and um, there's been already some evidence of it. We know that in Uganda, when these, for example, the MOUs that were being discussed, civil society has been cut out, except for faith-based organizations. In that
Mm,
case, we
mm,
haven't, or I haven't heard of other instances. However, I mentioned the America First global health policy that came out, I believe in September. Faith-based organizations are actually highlighted. And faith-based organizations have played a huge role in health systems in many
yeah.
countries, Kenya included. The church plays a huge role in clinics and medical services and the rest, and so there's definitely a role there. However, I think one of the things we need to keep in mind is that those groups that were part of Project 2025 who had a hand in crafting specifically the language around the Geneva Consensus Declaration of ensuring it was in Project 2025 to be handed to the Trump administration,
Yeah.
that there are a lot of groups in there who could be positioned to have some of that funding, carry out new programs, ensure that things
Mm-hmm.
go to where they want it to go, or conversely don't. And I
Mm-hmm.
mean, in Project 2025, key implementing US partner groups, traditionally ones that were receiving a lot of funding to do global health work, were specifically named as sort of anti-administration. So
Wow.
we know from that playbook that certain groups are probably never going to get US funds again, and that faith-based organizations are going to be promoted instead.
And yeah, and move into the space. Yeah. So, in closing, can you tell me what IPAS is doing? You're obviously documenting and speaking about this, but what else do you think can be done from the perspective of your
Yeah, we're
organization?
documenting, we're trying to get again, because IPAS doesn't receive US funds, but we're seeing how this is affecting our partners, our ability to do coalition work, who's not going to be willing to work with us on certain things. A main concern for us is really how this is going to affect public health service delivery. A lot of what IPAS does is accompanying governments and the public health sector to carry out programs that include not just safe abortion care, but the whole spectrum of family
Contraception.
planning and
Yeah.
contraception. And we do a lot in promoting gender equality, bodily autonomy, girls' education. So it's how is this going to have so much outsized impacts than just abortion? And to your point, what is this going to mean for some groups that are possibly going to benefit financially and going to gain further footholds in, frankly, promoting hate that is exported from the US to other countries
Mm-hmm.
through this administration.
Mm-hmm.
And again, we're seeing it in the last 2 weeks at the Commission on the Status of Women. We're seeing how other countries are using some of the same language. So it's that really concern for both health implementation, but also the policy space of regressing rights.
Mm, mm. Well, thank you for your work and all you do at IPAS. It's sobering to listen to this, but it's also important that we understand exactly what's going on so that we can mount our position to it and possibly get one day when Congress is prepared to act, maybe some congressional action on this. Yes. Yeah. Thank you so much, Jamie. A luta
Thank you very
continua.
much.
The fight continues.
Thank you.